Push the machine to the appropriate position of the infant incubator or radiation stage and adjust the angle of the instrument in order to make the observation and operation more convenient. Connect the oxygen and air supply hoses at the back of the instrument respectively to the oxygen or air interface at the central gas supply equipment belt or on the pendant. If the instrument is equipped with an air compressor, you shall connect air hose to the air compressor. Connecting the main machine, heater, humidifier, and air compressor to power supply. Then check the AC indicator on the face panel of NV8. If it is not on, please check the connection of power cable or if the power switch at the back of host has been turned on at the location I. Press power button for 3 seconds to turn on the machine. It will perform self-test and display the test result automatically. If there is any failure, please stop using the machine. If all tests passed, you can use it normally. Turn on the air compressor and observe the pressure gauge on the face panel. If the pressure displays around 400 kPa within the green zone, then you can use it normally. Open the prepare breathing circuits. Install the humidification pot on the humidifier and pay attention that the port interface should be parallel placed. Connect a short breathing tube between the INSP and the humidification pot. Insert one side of a long breathing tube into the humidification port that is close to the temperature probe and the other side fixed on the arm of the breathing pipe. Connect heater wire. Connect MR850 humidifier flow temperature probe. First connect proximal probe and then connect distal probe. For MR810, only heater wire need to be connected. Connect pressure sampling tube to the prox pressure sampling port on the front board. Open the pack of the reusable breathing tube. Connect the joints on both ends of the 60 cm tube. Thrust the drag hook of the heater wire into the tube. Pull the heater wire through the tube and connect the joints. Connect the temperature probe. Connect the heater wire adapter. Connect 13 cm extended breathing tube. Connect adapter. Connect the joints to both ends of the pressure tube. Use a short tube to connect the INSP interface and the short interface of the humidification pot. Connect a long breathing tube on the high interface of the humidification pot. Connect the temperature probe. Connect the heater wire. Connect the pressure tube on prox interface. Connect the pressure generator. Connect the high-flow oxygen therapy tube. There are two kinds of humidification pots. One is able to add water automatically and the other one is manually. Automatic water adding humidifier. Hang the sterilization water bottle on the water bag bracket. Connect the automatic water tube to the bottle. Open the pressure port of the tube and check whether the water is flowing along the circuits. Manually water adding humidifier Inject sterilization water into the humidifier and pay attention not past the maximum water level marked on the pot. Press the switch for 3 seconds to turn on the humidifier. Turn on VADI humidifier. After 5 seconds, the humidifier will be locked automatically with a key indicator being shut off. Press the lock icon for 5 seconds. You will be able to adjust the parameters after the keys are unlocked. When using the humidifier for the first time, you should choose servo control mode, where the temperature is set to 39 degrees at Y side and -2 gear at the heating plate. The heating plate is increased to 37 degrees. Heating tube increased 2 degrees. Temperature at Y end is 39 degrees. So the temperature at the patient's is also 37 degrees, as 2 degrees had been reduced without heater wire. 5 seconds after the setting, humidifier will be locked automatically. Press the lock icon for 5 seconds to unlock the key. Press the power off button for 3 seconds to turn off the machine. Connect to the patient. Fasten the pipeline. Fasten the breathing pipeline on the infant incubator and the radiation stage smoothly. Connect abdominal respiratory sensor. Operation principle. According to neonate abdominal breathing characteristics, the machine is able to measure patients' respiration through monitoring their abdominal breathing up and down station. Connect the abdominal breathing sensor to the breathing box. Cross the breathing sensor through the infant incubator. Place the breathing sensor at the left side or right side of the neonatal belly. You can choose the location according to the neonate's breathing situation. Place the breathing sensor on the surface of the skin by a surgical tape. Pay attention that the tape shall paste at the middle of the sensor airbag. Check monitoring setting of the sensor. LCD interface, configuration, parameter setting, sensor monitor, on or off. When you choose off, then you can close breathing monitor, which can be set according to the clinical use. Human-machine interface linkage, including pressure mode and HFNC mode. Pressure mode, 3 ventilation modes, NCPAP, NIPPV, SNIPPV connect with patients by pressure generator. Many-jet pressure generator. Paste an alga plug, artificial skin on the nose of the neonate to relieve nasal extrusion. Choose suitable nasal congestion and hat. Put the hat on the neonatal head. Pay attention that it doesn't cover their eyes. Install the nasal mask and nasal congestion on pressure generator with the arc side outwards and connect the fixing band. Fasten the pressure generator on the head. Pay attention that it shall be fixed close to the head and make sure it can be steadily held by the generator. Install the nasal congestion and nasal mask on the nose. Pay attention to adjust the angle of the generator and make the patients feel comfortable. Then paste triangle shape fixing band on the head. Connect the breathing pipe and pressure sampling tube. It is better for you to connect the circuits after generator is fixed. Under clinical practice, perform nasal care for the neonates once every 2 to 3 hours. Infant flow pressure generator. Paste an alga plug, artificial skin on the nose of the neonate to relieve nasal extrusion. Choose suitable nasal congestion and hat. Put the hat on the neonatal head and pay attention that it doesn't cover their eyes. Install the nasal mask and nasal congestion on pressure generator. Fasten the pressure generator on the head. Install the nasal congestion and nasal mask on their nose. Install the pressure generator on the hat. Pay attention to adjust the angle of the generator and make the patients feel comfortable. Connect the breathing pipe and pressure sampling tube. It is better for you to connect the circuits after generator is fixed. Under clinical practice, perform nasal care for the neonates once every 2 to 3 hours. HFNC mode. Connect the patients by a high-flow nasal oxygen tube in oxygen therapy ventilation mode. Choose a suitable oxygen tube according to nasal characteristics. Pay attention that the nasal tube should be smaller than their nostril. Connect the neonates with the tube. Pay attention that the curved side face down. Use the joint to connect the breathing pipe. Operation. Start ventilation. Select Start Ventilation in home screen page. Then it will breathe and ventilate according to current selected mode. NC-PAP mode selection and operation. Select NC-PAP and press Confirm, then the mode will be activated. Select airway pressure and adjust the value by rotating the trim knob. 3 different colors blue, yellow and red indicate different degree of pressure value, and then you can choose the suitable value. Select oxygen concentration parameter and adjust the value by rotating the trim knob. 3 different colors blue, yellow and red indicate different oxygen concentration, and then you can choose the suitable value. When the children apnea time surpass the default suffocation time, the machine will alarm and send out apnea-wake ventilation to help them recover spontaneous breathing. NIPPV mode selection and operation. Select NIPPV mode and click Confirm button. Then the mode will be activated. It will send out IPAP and PEEP at intervals. Select the PEEP parameter and adjust the value by rotating the trim knob. 3 different colors, blue, yellow, and red, indicate different degree of pressure value, and then you can choose the suitable value. Select IPAP parameter and adjust the value by rotating the trim knob. 3 different colors, blue, yellow, and red, indicate different degree of pressure value, and then you can choose the suitable value. SNIPPV mode selection and operation. Select SNIPPV mode. Click Confirm button. Then the mode will be activated. The patient's breathing will trigger IPAP, and there will be a long string on the interface to indicate the triggering. When apnea time surpasses the default suffocation time, the machine will activate apnea ventilation alarm till it triggers the spontaneous breathing again. HFNC mode selection and operation. Select HFNC mode and click to confirm it, and then the mode will be activated. Select flow parameter and adjust the value by rotating the trim knob. 3 different colors blue, yellow, and red indicate different flow value, and then you can choose the suitable value. Manual ventilation. This area is manually ventilation operation area. Select manually ventilation parameter and adjust the value by rotating the trim knob. Select the suitable value and confirm it. Press manual ventilation button and simulate the action of squeezing air back. Send out manual ventilation pressure. Quick oxygen ventilation. The default oxygen is pure oxygen. Click Quick Oxygen button to send out oxygen. The ventilation time can be set between 30 seconds and 120 seconds according to clinical demand. Alarm limit adjustment. Select Alarm parameter to set the respiration limitation. The alarm delay can be set to reduce mistake alarm in clinical. The alarm limitation set includes manual setting and automatically setting. System defaults automatic setting to reduce clinical working load. Automatic alarm, airway pressure, oxygen concentration. The alarm limitation will change accordingly. Maintenance and care in clinical use. Oxygen concentration calibration. When there is a big deviation between oxygen concentration monitoring value and set value, after entering into home screen page, you can choose oxygen self-calibration. During calibration, the breathing circuits should be disconnected. It will take about 1 minute to finish calibration. Oxygen concentration test. After the calibration of oxygen concentration, you can start test and validate the oxygen sensor. During test, you shall disconnect the breathing pipe from the patients. Choose oxygen concentration test on home screen page. Test 21% and 100% oxygen respectively. Choose 21% and 100% oxygen concentration test. If the test result passes, then it means the oxygen concentration is accurate. If the test result failed, then it means you should calibrate the sensor again.